Why did my epidural stop working at the end of my labor? My name is Sydney. I'm a labor and delivery nurse, and I'm going to tell you why this might be. So, I want to preface this by saying everyone's experience is different, and this is because of the providers that insert the epidural, your anatomy, and just the medications that are used at different hospitals and at different stages in your labor. But I do find a lot of my patients, or majority of my patients, tend to feel like the epidural stops working or wears off a little bit when it becomes time to push. This is because epidurals have trouble keeping up with the amount of pain and the progress of labor. So, labor doesn't just go like this with your level of pain, it slowly increases until the baby is born. So, if you get your epidural when you're here, you're going to feel a lot less pain, but the pain is still going to continue to increase. So when you get to this point up here, the epidural is having a lot of trouble to reach that same level. Another thing I like to say is that epidurals are really good at taking away that pain sensation, but they are really bad at taking away the pressure sensation. And when you have a big watermelon or bowling ball trying to come through your pelvis, that is an intense amount of pressure that can almost be painful. I always like to say, though, it is a good thing to be able to feel a little bit of pressure and pain because that helps you to be able to know where to push your baby out. Now, that might sound a little bit strange, but a lot of people tend to push in their heads instead of in their pelvis and in their bottom. And that's where we really want you to push. We don't want your face getting all red and pushing all in your head. We want you to push down into your bum. And that sounds a little bit strange, but it'll make a lot more sense once you actually have a baby. Again, if you're in a lot of pain though, there are things we can do to try to help. So there's something which is called an epidural top-up, and that's where we give you a little bit more medication through the epidural catheter to hopefully help get you through that hump until baby is born.